An 11-year-old boy, Shahrukh, not his real name, is arrested in March this year for committing theft. He is from SPYM in northeast Delhi. At the hearing, his mother tells the Juvenile Justice Board 3 that her child is a substance user. Her account reveals how the lives of a child and many others are being destroyed by drug peddlers in the area. One of the drug peddlers is a grocery shop owner, selling substances like whiteners, vulcanized solutions as well as drugs to children. Shahrukh's case is representative of an unending series of cases brought before the Juvenile Justice Board 3 in Delhi.
When children use drugs, there's not only a personal cost but an impact on communities. Studies show a link between drug use and juvenile crime. Children who are using drugs are more likely to be involved in crime to feed their drug habit.
A study published in the Indian Journal of Psychiatry found that of 487 juveniles held for different crimes, over 86% had a history of substance abuse. Residents of SPYM, one of Delhi's most marginalized neighborhoods, are agitated.
कानों के टॉपर्स उतरवाई सोने की, नाक की सोने की उतरवाई, और जो बैग बटुआ था मेरा वो भी ले लिया। घर की चाबी मेरे जैसे ये उड़ रही हैं, ऐसे चाबी उड़ रही वो भी ले लिया। बड़ी गाड़ी की बैटरी गायब, चोरियां या किसी का ताला टूटता रहता है।
नशा जो हो रहा है चोरी से और उठाएगी तो छीना झपटी से। ना हमारा यहाँ प्रशासन सुन रहा, ना एमएलए सुनता।
गली गलियों में घूमते हैं, खूब मारते पीटते हैं, लड़ाई झगड़े करते हैं। किसी की मोटरसाइकिल उतार लेते हैं, किसी का कुछ निकाल लेते हैं, बस शराब पी के चले जाते हैं।
तब माँ बेटी किसी की निकल नहीं सकती घर से बाहर अकेले। ब्लेड निकाले, जरा भी किसी को टच करो तो ब्लेड वगैरह निकाल लेते हैं।
In his order on 20th March, Principal Magistrate Arul Verma said the menace must be curbed. The police and the authorities need to intervene on a war footing. Under Section 77 of the Juvenile Justice Act 2015, the board banned the sale of whiteners, thinners and vulcanized solutions or solutions to children below the age of 18 years unless the child is accompanied by a guardian or has a letter of authorization from the child's school. The Delhi government has been directed to issue a notification to this effect. Any offence under Section 77 is punishable with a prison term extending to 7 years and liable to a fine of up to ₹1 lakh. The Principal Magistrate's order said, "We cannot be a mere witness to the systematic ruination of an entire generation that is gradually succumbing to the grip of drugs." Children using substances and drugs can be seen on the streets and in neighborhood parks in many parts of the capital. According to a survey by the Department of Women and Child Development, Delhi government, around 25,000 street children were abusing drugs and substances. The number would go up if school-going children are included. Experts say the age of initiation into drugs is getting younger. For example, 6-year-old Firoz, not his real name, who has not yet lost his baby lisp.
मेरा भाई तो चिका था, मैंने भाई को देखते देखते मैं ही चिक गया था।
अच्छा लगता था करना? नहीं अच्छा लगा। फिर करते क्यों थे?
नशा।
His brother is 8. The family is poor. While the father is disabled and unable to earn, their mother has a small tea stall.
नशा करने लग गया। इसमें मेरे दोस्त का पैसा सब लोग आधे आधे मिलाते। 25 रुपए मम्मी से लेता, 25 रुपए चोरी करता। बीड़ी, फिर रुमाल वाला, फिर उसके बाद गांजा।
It's a shame for us as a society, as a civil society. It's a shame because if we cannot protect a child of 5 or 6 years, then what we are going to protect? Because they are the future and they have to live another 80 years. So this individual will be, a problem for himself, for his family, for future generation. So something is drastically wrong.
In South Delhi, auto rickshaw driver Sunil Kumar's 15-year-old son got addicted to cannabis last year. He only found out when his son Anup, not his real name, began stealing from home.
स्कूल है, स्कूल में जो बड़े बच्चे थे उसके कारण हुआ है ये। बहुत बच्चे हैं वहाँ पे। उसी स्कूल।
Anup's mother worked as a helper in a nursery school. Worried about her children, she has now given up her job.
उसका पीछा मैं करती रही जब से मैं सुनी, और स्कूल में मेरे को मैडम ने भी बोली। हमको दुख भी हुआ कि हमने अपने बच्चे के लिए क्या सोचा था, क्या हो गया। जब वो बेटा ऐसा कर जाता तो माँ बाप के ऊपर क्या गुजरती है, वो तो आप जो माँ होगी वो बाप होगा वो समझ सकता है उस बात को।
मैं स्कूल जाता था, मतलब जैसे पहला पीरियड लगाया, दूसरा पीरियड लगाया, थर्ड पीरियड में चले जाते थे कहीं बाहर, कभी पूरा स्कूल फुल लगाया, फिर कम फिर बंक मारने लगे 1-2 दिन। वो एक दिन पी थी स्मैक।
Another important factor, majority of the schools in Delhi, they are in 2 shifts. First shift for girls, second shift for boys. Now what they do from 7 o'clock or 8 o'clock till 1 o'clock? There's no neighborhood monitoring of these kids. And then what will happen to girls? After 1 o'clock, there's no one around. So these are all the big challenges for urban city like Delhi, where state mechanism doesn't exist. Anganwadi is over by 1 o'clock. There's no support at the school because counselors are not appointed. There's no support at the local community because all these support services are not available. If the families are interested, taking them to treatment center, most of the treatment centers are very expensive.
For the first time, significant steps are now being taken to acknowledge and deal with the problem. The Delhi government has provided space for 3 de-addiction centers for children. The centers, the first of their kind in the country, are run by SPYM, an NGO. One of them is for juveniles in conflict with the law. Equally important are 2 recently opened de-addiction centers for children who have not been associated with crime. There are 80 children between the ages of 5 and 18 at the facility for boys and 7 at the facility for girls. Early intervention is key as the success rate is high. Children who've used drugs for as long as 2 or 3 years need a greater investment of resources. They are also at risk for being involved in deviant behavior and crime. Children are sent to the centers by child welfare committees to rid them of their drug habit. The services are free of cost to the parents. Typically, children stay for a period of 3 months or more and receive counseling to help them stay away from drug use. They are also provided literacy and vocational skills for long-term rehabilitation. Anup is now admitted to the Center for Boys.
हर हफ्ते में मैं जाती हूँ शनिवार को, तो मेरे बच्चे में फर्क देखेगा तो कोई भी माँ जो बच्चे को देखेगा तो खुश होएगा। अब उस टाइम में और इस टाइम में बहुत फर्क है, उसमें बदलाव भी बहुत आया। हमको भी मतलब अब इतना प्यार करता है तो बहुत अच्छा लगा मुझे ना। आज कह रहा था मम्मी मुझे राखी के दिन लेके चलोगे ना, हमने कहा कि हाँ लेके चलेंगे। फिर आप कहाँ जाओगे, घूमने जाओगे? कह रहा नहीं मम्मी अब मैं नहीं जाऊँगा कहीं भी। तो मैंने कहा अच्छा।
The young boy says the easy supply of drugs should be stopped.
तो उन्हें नशे से दूर रखो, मतलब नशे से दूर रखो।
और जो नशा जो बेचते हैं उनको पता है कि बच्चे ले रहे हैं?
हाँ, उनके सामने आते लेते हैं।
बेचने वाले जब तक रहेंगे तब तो ये बच्चे खरीदते रहेंगे। तो आपको नहीं लगता कि सरकार को ये रोकनी चाहिए किसी तरह?
तो रोकनी चाहिए सरकार को, तो इस चीज़ को रोकना ही चाहिए। बच्चों को क्यों देते हैं, ये तो सबसे बड़ी बात ये है।
The program is unique because it is targeted at children and tailored to suit their needs. Parents who had only known a sense of hopelessness are beginning to realize that children too can be de-addicted of drugs.
At the weekly meeting between parents and children, Chandravati has brought her son his favorite aloo sabzi and puri. She works as a cook. Her husband, who is an alcoholic, does not contribute to the family expenses. Her son Raj, not his real name, was addicted to cannabis.
मैंने अपनी जिद करके मैंने यहाँ डाला ही है कि पति तो ऐसा था ही चलो दारू पीने वाला, मगर बच्चा तो अच्छा बन सके, इसलिए।
कितना कमा लेते हो तुम?
मैं 8,000 कमा लेती हूँ उससे। फिर साड़ियों में फॉल वगैरह, लेस वगैरह ये नाइट में लगाती हूँ रात को, तब जाके घर का खर्चा पूरा करती हूँ।
कुछ कामों में लगा देते थे हमें, ताकि हमें महसूस हो कि हमारे से गलती हुई है। कोई ना कोई काम दे देते थे कि ये करो ये करो, नहीं तो आधे से ज़्यादा तो क्लास होती थी।
बस उसे तो ठीक लग रहा है, मगर वो ये कहता है मम्मी मुझे अभी 1.5 महीना हो जाएगा मेरा पूरा, फिर मुझे ले चलना। अभी पता नहीं, अभी कल परसों का रिजल्ट है 9 तारीख का। इस रिजल्ट से यूपी बोर्ड से।
पहले तो हम स्कूल का टाइम काट के जाते थे, फिर उसके बाद मैम स्कूल में फर्स्ट पीरियड लगा के बाहर चले जाते थे। मैम किसी को पता ही नहीं लगता था।
तो फर्स्ट पीरियड क्यों जाते थे फिर? फर्स्ट पीरियड
मैम उसमें हाजिरी होती है ना, पूरे दिन की हाजिरी लग जाती थी उसमें, मैं बाहर चले जाती। पहले इस चीज़ पे पाबंदी लगानी चाहिए कि कोई भी बच्चे को ना दी जाए ये चीज़।
जो बेचते हैं?
हाँ मैम।
वो उनको पता था कि तुम बच्चे ले रहे हैं ये?
हाँ मैम, वो छोटे छोटे बच्चों को भी दे देते हैं, उन्हें खाली पैसों से मतलब होता है। कुछ ज़्यादा ही मैम फैल गया अब तो खैर दिल्ली में।
दुकान थी, तुम पार्क में बैठ के लेते थे? पुलिस वाले नहीं आते थे उस पार्क में?
नहीं, वो अच्छा पार्क था, झूले बूले तो बड़े बड़े लोग आते थे और हम भी अच्छे बन के ही जाते थे।
और किस में लगाते थे सोल्यूशन?
कपड़े में, पिल्ले में। मम्मी पापा देते थे 10-20 रुपए स्कूल जाने के लिए किराया, उसमें से बच जाता था मेरा।
तो कितना तुम्हारा खर्चा कितना होता था?
मेरा होगा 400 रुपये। मैं उनके साथ कवारा मिलने लग गई थी।
अच्छा।
बोतल नहीं होता जो बोतल पानी का, ट्रेन में से बोतल निकाल के बेचते थे बस।
तो ये जो ओमनी दुकानदार बच्चों को भी देता है क्या?
हाँ उनको ही तो देता है, वही तो पीते हैं ज़्यादा करके, वो नहीं लेंगे तो इनका बिक्री कहाँ से होगा।
A number of these children belong to dysfunctional families. A survey conducted in Simapuri in June found that apart from peer influence, drug use by a family member was a major cause. Another positive development is the setting up of juvenile de-addiction wards in the capital. 60 beds in 6 government hospitals are now dedicated to juvenile de-addiction.
Delhi's first juvenile de-addiction center was opened at the Madan Mohan Malviya Hospital in March last year. In the last 15 months, the hospital has treated 106 children.
Children from SPYM's de-addiction centers are admitted to the hospital ward first for detoxification and treatment of any comorbidities like TB, HIV, breathing problems and malnutrition.
When the child comes here, we de-addict the child by the psychiatrist. There is a psychiatrist here, there is a senior resident also here. They do the de-addiction first, they examine if their patient has some other comorbidities. General medical examination is done, and if there is any problem with the child, that is also taken care of, because this is a multi-speciality hospital.
Of the children admitted to the hospital so far, 2 were found to have HIV. Usually the child stays for 15 days in hospital. When the child is ready to be discharged, SPYM is informed so that they can collect the child.
This treatment part is a very small, it's like in middle, the whole for the addiction. The source that has to be curtailed, and the rehabilitation part is very, very important.
The children have peer attendants who are former drug users. They play the role a family plays in a hospital setting and are also skilled at handling behavioral problems that a drug user may display.
We have got 3 peer attendants who are posted here round the clock. 1 peer attendant is always available for these 5 patients round the clock.
Is that system working well?
That is working well. We are in constant touch with the NGO. NGO is also in constant touch with us.
What is lacking, however, are clinical psychologists essential to the team. They are being recruited now, as are more social workers. There were repeated directives by the Juvenile Justice Committee, which is chaired by a High Court judge, that juvenile de-addiction centres should be opened in each district. However, it was only functioning in 1 hospital. Then followed strictures from the Juvenile Justice Board in March this year. It fast-tracked the appointment of staff by the Delhi government for running the other 5 de-addiction wards. At Deep Chand Bandhu Hospital in the city, a 30-bed centre was inaugurated in April. 17 children from the SPYM centre are currently admitted here.
यहाँ लेकर तो मैम बढ़िया ही लग रहा है, मर गया अच्छा है, मतलब कि कुछ।
कितने दिन हो गए यहाँ पे?
मेरे को हो गए 1 महीना 16 दिन। यहाँ पे मुझे खाना अच्छा लग रहा है, पढ़ाई होती है यहाँ पे, मैम पढ़ाती है, भैया लोग है हमारे को नहलाते धुलाते हैं टाइम पे। जिंदगी में जो काम मिलेगा वही करेंगे, नहीं तो मैं अपना दुकान खोलूँगा जब मेरा सर्टिफिकेट बन जाएगा। कोई बनाएगा तो जब खोल सकता हूँ मैं तो।
See, this came from the Juvenile Justice Board, where they said that there are a lot of street children and they are drug addicts, and this facility or this sort of program is really needed for these children.
This is absolutely the need of our in this area, specifically in Delhi, Punjab, Haryana, because here it is very easy to procure drugs. They are readily available, and children get into these things very easily. They can be manipulated into getting it.
Clearly, it's a work in progress, as there are numerous challenges. 4 of the children have HIV. Relapse rates are high, so revisits after every 15 days is essential.
A lot of children here on assessments have been found to having serious ailments like attention deficit hyperactivity disorder, and some have autism, and some have subnormal intelligence like mental retardation, it is known as that. So for those in children, they are not able to convey their problems easily, and these illnesses also lead to addiction with an increased frequency. So for detecting these problems we need assessments, and for that we need clinical psychologists in more number, and we have been deprived of food also. So we are talking of art therapy here. A very important thing is that treatment is fine, but planning of post-treatment phase is important. Otherwise the treatment success of a treatment is very low.
The Delhi government recently set up an intersectoral coordination committee bringing together different government departments like health, education, social welfare and the police.
That was the main problem we faced, that not a single department was responsible for the entire thing. But now it has very beautifully come together through the intersectoral committee, which is headed by the senior most civil servant, that is the chief secretary. So all the departments are bound to kind of carry out whatever is proposed in the intersectoral committee meeting.
A notification to ban the sale of substances is being brought out.
Honorable Lieutenant Governor has approved a notification which shall be banning the sale of such substances which are habit forming, like sulochan, we call it vulcanized solutions, which are used in tire shops by mechanics and in workshops to kind of hold together the tubes and tires. That is abused in a big way. Glue and that white solution which is used to erase the pen marks and all of these substances, nail polish remover. So all of these substances now cannot be sold unless they are in a tube or something which is difficult to take out, and secondly they cannot be sold to children under 18 years of age.
The Juvenile Justice Board has said that it is expected of the Delhi government to make all-out efforts to secure the best interests of children. It is not only a constitutional duty but a statutory one.